Yeah, so generalized pustular psoriasis, or as you mentioned, GPP, is a chronic inflammatory condition that can wreak havoc all over the body. As a dermatologist, let's focus on the skin though. The rash of GPP can occur anywhere and can be painful and itchy, but most notably, it's often covered with little non-infectious pustules, which pretty much are blisters filled with pus. This condition is way more than skin deep. Often patients flaring will have fever, joint pains, lethargy, often leading them to the emergency room and even hospitalization, and this can be life-threatening. Very importantly though, this is not psoriasis. I know it's in the name, but this is a distinct disease that comes with distinct issues as well as unique treatment options. So I think it starts with education that's available to those suffering and loved ones, but also for physicians. Because this is a rare disease affecting only about 1 in 10,000 people in the US, often patients will be misdirected or there'll be delays in diagnosis. The condition will be called something else, often something infectious, which I think adds to maybe the burden of disease. They'll be treated with antibiotics, antivirals, antifungals, which will do nothing for this condition, adding to that burden because there's a cost and a time impact. Ultimately, hopefully, these individuals will get to a board-certified dermatologist where the diagnosis can be made. But all the while, that'll affect career, family, social. This is a very visible disease that really runs you down, and so can really take its toll on the individual, but also the family.
GPP has affected my life via parenting, career-wise, social life. It impacts everyday life. Anything you can think of that you do on your daily basis, GPP can affect it. However, as someone living with it, I like to control the controllables, control what I'm able to control, and whatever I'm not able to control, I just let it go, because stressing about it or trying to control that you can't control or the unknown, you will cause yourself to go into a flare-up.
It starts with just that, awareness, which leads to validation to those suffering, but it also gives us an excuse to train the future of dermatology, to train and educate the public, whether it be those suffering, those in that network, or even beyond, to recognize this as an independent disease. Because when we start paying attention, good things happen, like investments in research and development that altogether will benefit those with GPP.
One of the biggest things that I like to say is education is key. Yep. Don't settle for the answer no. And it is a journey that you have to keep a tight hold on. Now, the journey is not always straightforward. There will be some twists and turns. However, you have to have that open mind that with education and awareness that you can keep a hold of your GPP journey and you can control it. The awareness itself is good for everyone, not just the person like myself living with it, but also the caregivers, the lovers and supporters that are around them, as well as the doctors. So GPP itself, education is key. Never give up and don't settle.
Oh, the first stop off that train is going to be gppandme.com, a resource dedicated to this condition to answer all your questions and more.